My name is Henrik Zetterberg. I'm a professor of neurochemistry at University of Gothenburg and at University College London. My specialty is fluid biomarkers for Alzheimer's disease and other neurodegenerative dementias. This has been a very exciting development, the blood biomarker field in Alzheimer's research. And I must admit that I never thought it would work, not original at least. So I work in Sweden, and here we do CSF analysis. And I always thought that the blood-brain barrier would make the blood biomarkers, that it was a bit of futile work to focus on that. And I have also been very happy with the CSF biomarkers and the way we have developed and improved those tests. But approximately 10 years ago, I got an email from a small biotech company where they described a new technique with which they could improve the analytical sensitivity of the ELISAs we used to measure the CSF Alzheimer biomarkers with. And they wanted to discuss potential collaborations, because if one had a 1,000-fold improvement in the analytical sensitivity, well, maybe there was a blood biomarker signature that could pinpoint Alzheimer's disease. So we started to work with beta amyloid, phospho-tau, and total tau. And quite soon it became clear that there is a blood biomarker signal, and that the reason for why we hadn't seen it before was that the sensitivity of our tests was not good enough. Now this field has exploded during the past 2, 3, 4 years, and we have seen numerous publications on plasma Aβ42/40 ratio, plasma phospho-tau, and also plasma neurofilament light, and a protein called glial fibrillary acidic protein. And these sort of capture the classical amyloid tau neurodegeneration biomarkers that we have had in cerebrospinal fluid. There are now multiple analytical platforms with which one can measure these biomarkers, and some are also automated and give to me promise that these could become tests that could be really implemented in clinical practice in a very affordable and available way. So I'm very hopeful that these biomarkers will roll out. It's also important for another reason, and that is that Alzheimer's disease is such a common disease. So if general practitioners could start to at least pre-screen with these blood biomarkers when they have patients who seek medical advice because of worry of memory problems or other cognitive symptoms, that would be I think that would speed up the time to which patients can get the correct diagnosis. And if we pair this with effective disease-modifying treatments, this could really be transformative. At least I hope it will be like that. The blood biomarkers are surprisingly good, but if you compare head to head, for example, plasma Aβ42/40 with CSF Aβ42/40, we have what we call a robustness issue. So in CSF, we have a much clearer group separation. The fold change between amyloid positive and negative people are approximately 50%. In blood, it's only 10-12%, and the overlap is larger. So I have still not given up that we should, I still think we should be able to do CSF analysis in individuals who get gray zone results, and then one could state to the patient that, okay, we don't know what this blood test really indicates. It's a little bit in the middle of normal and perhaps a little bit pathological. Let's do a CSF, or let's do an amyloid PET or something else. And this is exactly the way we work with clinical chemistry tests for other diseases in the body, like cardiac tests, liver tests, kidney tests. We combine blood biomarkers with imaging or more functional tests, and after a few weeks of investigations, perhaps we can actually make a diagnosis that is quite accurate. And I hope then that these blood biomarkers for Alzheimer's disease and neurodegeneration will work a little bit like that. Early diagnostic tools that can help tell if a patient is very likely to have a certain disease process, for example, Alzheimer's disease, and then help the patient to get a more definitive diagnosis. And also in the near future, I hope access to disease-modifying treatments in addition to the symptomatic treatments that we already have.